Our next speaker is Dr. Parthopratim, Dr. Majumder. Dr. Partho is, of course, a senior consultant in the uveitis department in Shankar Netralaya. But another important aspect to his personality is that he is the founder and operator of the eOphtha online resource, and he has extensive experience and knowledge about this topic, resource options for training in ophthalmology.
Thanks, Devendra, for having me here. For having me here. So, so I'll be talking on resource options in training in ophthalmology. I think Devesh has made my job very easier because he has discussed all the exam-related textbook and the other resources. So I'll be talking, concentrating only on options which are available online. Just a disclaimer, I run this website for a long time, so I won't be discussing about this. So let's start. So when we think about online resources, I feel it is always better to learn from the best. So if you want to learn about a topic, particular topic or particular clinical entity, I always feel you should go to PubMed, search for the systemic reviews, meta-analysis and all. Cochrane reviews are also there. So you can, many of those articles are free for download and you can download and read them properly. So that is very important. And the second thing is that AIOS has a system of registering into the one network. I think for last 3 or 4 months it's not working properly. So this one network is a very useful tool where you can access a lot of journals here. The online journals, you get the all articles to download, and you can see here there is an entire series of renowned journals available in under this network. And there is a very interesting questionnaire sessions also, like MCQ type questions are there. So you can test your knowledge, and depending on your subspecialty, you can take these exams. And you can see here, this is a section of the uveitis which has 134 questions, and each questions there is an answer, and you will get a proper explanation of those answers. Now, another important part of this one network and this section is that they have a preferred practice guideline. So where there are various entities, they have they are like dry eye, that refractive surgeries, esotropia. So there are various topics they have covered in this preferred practice pattern. So another important is there is some case discussion. So a single case they have discussed in details. The various renowned people from the respective field, they discuss and analyze those case reports. So very good for us, and I feel it is a very must for the postgraduates and all the ophthalmologists. Then there is another popular website called Success in Emercy of, I think very old website, and very good collection of various basic eye examination. There are also information about Emercy of and ophthalmic trials, trivias, guidelines. So you must visit this website. Then coming to that, there's University of Iowa has several websites, and this is one of my favorite. This website is based on the gonioscopy mainly. So you can see a lot of videos, a lot of tutorials, and a lot of tips and tricks to decode various cases. So this is again the gonioscopy.org. So you can go and visit this website. This is another website by Professor Edward Stone. So he has created this website. This is very unique, again Iowa University initiative. So you can go there and see their atlas. They have some simulator where they present a case and you have to diagnose them. So most of this atlas, they deal with this hereditary heredomacular degenerations, and you can actually learn about the genetic inheritance of this disease as well. Now, this is another highly recommended website by CyberSite, and I think this is my best, means my favorite recommendation here. You can see here there are structured courses. For example, you see here there is a 12-hour online course on MICS, and you look at that, there are module systems. So each module, after module, you have to give an online exam. And for example, if you see here, the module 1 deals with the evaluation of adult cataract and preoperative assessment. So similarly, they have divided into various interactive sessions also. There are a lot of video-based presentation, and you can learn a lot from those. For example, this is about that module 1, that about the adult cataract and preoperative assessment, and you can see how the course is, has been structured here. This is again that basic history taking and evaluation of adult cataract. You can see here how they have structured it. First, the outpatient appointment, history taking, ophthalmic evaluation, and you see here how they have discussed these cases, like a difficult possible scenarios, and what are the action to be taken for those conditions. So CyberSite is a very useful website for online resources. Now, this is, I think, one thing is getting popular in our world, like they call it traffic university. I think Ravin Sharma was the first to popularize it. If you have a long time for to commute to your workplace, or you are going to a place, so you can listen to certain audio clippings. They call it popularly podcast and all. So this is getting very popular in ophthalmology also. So here you can get one that's straight from the cutter's mouth. So there are several sections which are very interestingly designed so that you can learn while driving, or even simple, if you are going for a walk, you can actually listen to them. So this is another Eyes for Ears. This is another, you can see here that there are several topics they have discussed. For example, one interesting I have listened to is that pigment dispersion syndrome. It gives you a complete overview in a audio-based presentation. There are a lot of resources to learn about the OCT. This is one, OCT cases. This deals with, most of this content of this website is free, so you can go and check. This is one, the recently designed the website, the Eye Care PD. So these are very good. These are they have several several courses rather. So you can see here they have designed one called Interpret. So what is that? That is because this is a interactive learning courses, and they give you several case scenarios and help you to understand the pathologies, and help you to decode all the diagnoses also. So there is one section called 1 minute OCT overview course, where they will show you a case and you have to decode it. Then there is a Eye Care PD Pro, which costs around 11,000 rupees. So that gives you overall OCT diagnosis. And there is another section called macular OCT interpretation, which is available for 3,000 rupees, and that gives you an overview of the only macula centric OCT. Now there is also a popular website, the iLearn, which deals with mainly the postgraduate exams and postgraduate question paper of various universities. Then this is very highly recommended by the Moran Core. This is very interestingly done. You can see that several sections here. Each section has grand rounds, the resident lecture, the surgery videos, and various other options for the students and residents. Then there is a iFocus Online. All of you are aware of that. There is a YouTube popular channel, so you can actually listen to all these videos. Several subspecialties lectures have been added there. And this is a dedicated website by the Professor Andrew Lee. It's a neuro-ophthalmology. So there are several interesting videos you can go through, and he has explained it in very simple way. And I won't recommend you for the ChatGPT, because as you know, the main problem with the ChatGPT, as in a Lancet editorial, they said that there are a lot of they called it illusion. means that ChatGPT can actually generate some artificial references and can cite from sources where you don't know. So if you are blindly following whatever the ChatGPT is generating, you will be in trouble, because sometimes if you ask them for some references, they will cite something which are not available in the literature. So this is another, I feel this is the answer to ChatGPT. This is called perplexity. So perplexity is similar to ChatGPT. The free version is also available and the paid version is available. The main interesting point of this is, for example, I have see here, I have just asked them that what are the differences between valsacloprid and valganciclovir. So they have given me the answer, but if you see here, there is reference here, and you can see that they have quoted the references, and this includes that 2 quotation from the PubMed also. So sometimes if you want to know certain things like some intravitreal dose or something like you need the exact figure for, so you can use this perplexity, and that will give you the reference also, and you go to that reference and cross check your whether it's true or not. Thank you for your patience here.
Wonderful, Partho. I think you've covered past, present, and future of online resources in ophthalmology.